Distinguished participants, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. It is my great pleasure to welcome you all to the webinar on occupational safety and health systems during the pandemic, the impact and response, a joint event organized by Statistical, Economic and Social Research and Training Center for Islamic Countries, SESRIC, and the Directorate General for Occupational Safety and Health of Turkey, within the framework of the OIC Occupational Safety and Health Network. I would like to thank distinguished panelists who joined us from different regions of the OIC for accepting our invitation and designating time to participate in this important webinar. Also, I would like to extend my deep thanks and appreciation to everyone who is watching our live stream today, who is going to watch the recording later. Let me introduce myself. I am Onur Çağlar, the Acting Director of Training and Technical Cooperation Department here at SESRIC. I am honored to moderate this webinar today. Without further ado, I would like to give the floor to His Excellency, Mr. Nabil Dabur, Director General of SESRIC, to deliver his welcoming remarks. The floor is yours, Excellency.
Bismillah ar-Rahman ar-Rahim, distinguished participants, ladies and gentlemen, Assalamu alaikum wa rahmatullah wa barakatuh. It is a great pleasure for me to address this webinar, Occupational Safety and Health Systems during the pandemic, the impact and the response. We are honored at SESRIC to co-organize this webinar with the Directorate General of Occupational Safety and Health of Turkey within the framework of the OIC Occupational Safety and Health Network. We are delighted today to bring together 5 distinguished high-level representatives of the national occupational safety and health authorities from different regions of the OIC member countries. On behalf of SESRIC, I would like to extend my sincere thanks and appreciation to all of you for accepting our invitation to contribute to this webinar. I welcome you all. Dear participants, the outbreak of COVID-19 pandemic has disrupted our life at all levels, including travel, trade, tourism, and labor markets. Workplaces, including health and safety of workers, were not exception from the negative impact of this unprecedented health crisis. During the pandemic, we witnessed the rise of essential services mood as a safer operating mood for work in many businesses. However, some of the protective measures that have been taken to limit the spread of the pandemic and to continue work operations, such as home office, remote working model, and physical distancing measures, cannot be applied to all types of jobs due to the specific nature of some jobs. Although some economic sectors and companies have been able to implement remote work policies, a significant number of workers continued to commute to their workplaces under burdensome circumstances. In all cases, more new innovative occupational health and safety measures are still needed. The current situation of the pandemic in many countries around the world, including our member countries, is still urging all stakeholders, in particular the national occupational safety and health institutions, to undertake risk assessments and implement preventive measures to cope with this unprecedented crisis. As it is well known, the level of the risk of the workers' exposure to COVID-19 in the workplace depends in part on the type of the industry or business. This risk is classified from high to medium or lower risk. To apply appropriate precautions measures, workers should be informed by employers about the virus and the way of protection. Disinfection exercises at workplaces should be conducted and personal protective equipment should be supplied. In this context, DOSH authorities should play an important role in setting the regulations, providing necessary guidance, resources, and training, and assessing exposure risk levels at workplaces for the control and prevention of COVID-19. Distinguished participants, with a view to continuing the implementation of our planned training activities for this year in the area of OSH during these difficult times of the pandemic, we at CISRIC started to conduct our activities online through various digital platforms. In this context, I'm pleased to inform you that we have organized two important outline capacity building training courses in the field of occupational safety and health, namely inspection services for occupational safety and health and occupational safety and health structures, to support the efforts of the OIC member countries in improving workplace safety and health during this challenging time. Today, we are also pleased to conduct this webinar within the framework of OIC Occupational Safety and Health Network, OIC OSHNet, which we as CISRIC assume the role of the OIC Technical Coordinator of this network, whereas the Directorate General of Occupational Safety and Health of Turkey assumes the role of the Secretariat of this important network. As you may recall, the OIC OSHNet has been initiated in 2011 as a cooperation platform gathering the national OSH authorities in OIC member countries with a view to facilitating the share and exchange of knowledge, experience, and best practices among these institutions. OIC OSHNet has been welcomed by the first OIC Conference of Ministers of Labor in 2011. So far, 3 meetings have been convened, the last one of which was in April 2018. In this connection, I would like to make use of this opportunity to inform you that currently the Directorate General of Occupational Safety and Health of Turkey, in its capacity as the Secretariat of the OIC OSHNet, and CISRIC in its capacity as the OIC Coordination Institution of this network, are preparing for organizing the 4th meeting of this important network to be convened virtually in October this year. The main 2 objectives of this meeting will be, first, reviewing and discussing the activities that have been implemented so far under the umbrella of this network, and second, activating the work of the OIC OSH network through discussing and adopting new rules of procedures and 2-year work plan of action, 2021-2022 for this network. Dear participants, in fact, the exchange of knowledge and sharing of experiences and best practices among the OIC member countries during these difficult times are needed more than ever before. Therefore, I hope that this webinar would provide insights on how the national OSH authorities in our member countries can play a more significant role in supporting the national emergency response policies against COVID-19 pandemic by setting standards and regulations that help all stakeholders in different fields. I am confident that it would also offer further collaboration opportunities among the members of the OIC Occupational and Safety Health Network. Before concluding, I would like to thank you all once again and wish you a fruitful exchange of experiences and productive discussion that can hopefully inspire other OSH authorities in OIC member countries that are working on setting their regulations and guidelines. Thank you all for your kind attention. Assalamu alaikum wa rahmatullah.
Thank you very much, Excellency, for your welcoming remarks. Now, I would like to give the floor to His Excellency Mr. Cafer Uzunkaya, Director General of the Directorate General for Occupational Safety and Health of Turkey, the Secretariat of the OIC OSHNet, to deliver his welcoming remarks. The floor is yours, Excellency.
Thank you. Dear Director General, esteemed directors of OIC countries, and distinguished guests, Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I sincerely thank our esteemed panelists from OIC countries for accepting our invitation to contribute to this webinar. You are welcome. I also would like to express my great pleasure to participate to the webinar, which we have realized in cooperation with CESRIC. We are going through an extremely difficult period where the COVID-19 epidemic affects negatively human life and economic stability. As we follow the situation regarding to the disease closely, and Turkey has taken the necessary measures quickly. Thanks to the measures we took, our strong health infrastructure and the methods we developed, we are among the countries that survived the epidemic with the lowest death rate. We didn't have any shortage in anything from healthcare services to the basic needs such as masks, overalls, medicines, disinfectants, and food. We are trying our best not to leave the friendly and broader countries along during these troubled days. We, Turkey, have sent medical aid to 6 international organizations and over 150 countries, including United Kingdom and USA. We are going through a process which we understand the importance of occupational safety and health again for an efficient and productive working environment. Due to the global COVID-19 outbreak, this process has reaffirmed the importance of the preventive and risk-based approach that forms the basic of occupational health and safety in business and social life. From the first moment of the outbreak seen in Turkey, we, DOSH, provide guidance to business considering the differences in prioritizing high-risk sectors with the approach. Our strong team of experts with the contributions of academics from university who are experts in their fields presented many informative and guiding publications for workplaces to the benefit of the parties. We will continue to stand by our employers and employees these days, which we call controlled social life. Dear colleagues, we have been conducting training, experts exchange, and capacity transfer activities with CESRIC for more than 10 years within the framework of IEC, OSHNet, and we have been leading many effective collaboration together. Before I end my remarks, I would like to announce the 4th meeting of IEC OSHNet on 7 and 8 October, and I will be glad with your participation. I extend my heartfelt greetings on behalf of my country with the hope that we all will succeed fighting against pandemic. I wish you safe and healthy days. Thank you again. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Mr. Uzunkaya, for your welcoming remarks. As you may all know, the outbreak of the novel coronavirus since late last year has disrupted life at all levels in the OIC member countries and the world at large. Consequently, the health crisis has affected all the economies with direct impact on the health and safety of workers in various fields. Today, we are going to explore in more detail how some OSH authorities have been dealing with this crisis by setting new policies and regulations and contributing to the emergency response of their respected countries. Before we start the discussions, I would like to kindly remind our viewers to submit their questions to the panelists via CESRIC's YouTube channel or CESRIC's social media platforms, and we will try to address as many as possible during our Q&A session at the end of the webinar. Now, please allow me to introduce our first panelist at our webinar today, joining from the Republic of Azerbaijan, His Excellency Mr. Orhan Hüseyinzadeh, Deputy Chief of the State Labor Inspectorate Service, Minister of Labor and Social Protection of the Population of the Republic of Azerbaijan. His Excellency, we are ready to listen to you. The floor is yours.
Thank you. Dear participants, dear YouTube watchers, Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to greet everyone and thank organizers for this chance to evaluate the current situation based on our experience, share our views on the future developments and ways to change the current and future efforts of COVID-19 pandemic. First slide, next slide, please. The COVID-19 pandemic in the The COVID-19 pandemic in recent months has radically changed our life. A special quarantine regime has been applied in Azerbaijan since March, aimed at preventing the spread of infection in the country. Next slide, please. During the special period, we have replayed the recommendation on the following topics. Is it not that slide? Next slide or previous? Third one?
Yeah, next.
Is that now correct?
And fourth one.
Fourth one now, please. Please.
4, 5, and 6.
Sixth slide, please. Slide number 6. Please. Thank you. The COVID-19 pandemic recent months has radically changed our life, and especially quarantine regime has been applied in Azerbaijan since March, aimed at preventing the spread of the infection in our country. During this special period, we have prepared recommendations for following topics. Physical distance. Enough distance must, next slide please. Distance. Enough distance must be maintained between people. Virtual work must be as much as possible by telephone, email, online meetings, worksheets, etc. Hygiene, next slide. Next, hygiene is available of adequate disinfectants and antiseptic in the workplace, increasing the number of places of handling, washing, and availability of hard tools. Cleaning work, regular cleaning of workplaces and desks, disinfection or of door handles, computer equipments, other frequency used items with regular antiseptic materials, disinfection of common rooms, sanitary facilities, etc. Instruction and awareness raising activity. Next slide, please. Instruction all employees on rules of the using of personal protective equipment in the pandemic, the safe performance of their duties. People over the age of 65 were not allowed to leave their houses and apartments. Social services were provided to single people of this category in accordance with the law. Access to several cities and districts, including the capital of Baku, was restricted, with the exception of special proposed vehicles, including ambulance vehicles, emergency vehicles, rescue vehicles, and the trucks. All these still continued, and the steps taken are under the full control of the government and state agencies. According to the latest statistic, 33,481 people have been infected with the virus in the country. 30,856 recovered, and 495 people have died. There are now about 2,380 active patients. Next slide, please. The entire health system has been mobilized for the virus. During this period, 10 modular hospitals of treatment of coronavirus patients in the capital and several districts were fully commissioned with the mayors and additional 2,000 hospital beds. At the same time, the country leadership appreciated the dedication of doctors. As a result, the president instructed to increase the salaries of doctors up to 3 or 5 times of monthly salary, depending on their level of contact with COVID patients. According to the administration of regional medical divisions, 45 quarantine and special hospitals have been allocated in the country to fight this pandemic, including modular hospital. As all we know, the world of work could not stay out of this infection. The rules of work have changed. There is need to apply new rules. The action plan approved by the Cabinet of Ministers in connection with implementation of the decree of President Ilham Aliyev, dated on March 19, 2020, includes large-scale, effective and expanded measures to reduce the negative impact of coronavirus infection of national economy. Employment and internship. I would like to note that protection of job, employment, and social welfare support were among the main priorities in this document. According to the action plan, the Ministry of Labour and Social Protection of Population has taken measures in several areas to support employment and social welfare, including protection of workers from the risk of unemployment and social protection, and this process is ongoing. The action plan includes 12 legislative enactments and in 4 areas: support employment and social welfare, covering 48% of total population of the country. With the new support measures announced by the President of Azerbaijan, in general, the fund allocated for the action plan are about 3.5 billion manats, which equals $2 billion. Such support measures in connection with the pandemic cover about 5 million citizens. Serious work has been done to protect the jobs and wages of employment in the private sector. Also, the 80%, 910,000 public sector workers did not go to the work during the quarantine period. Their salaries are being supported by government. In the private sector, 600,000 people working in pandemic affects area have been instructed to provide state support. The 320,000 people have already benefited from this support. 2 million citizens were provided by sustainability payment for the social security, pensions, benefits, and etc. In April and May, one-time payment program of 190 manat was implemented, covering by 600,000 people. And in July, in the second shutdown, about 290,000 people, low-income and unemployed people in the 16 districts and cities. The number of paid public jobs has been increased to 19,000 to increase employment opportunities. And 65,000 people have already been employed under the employment contract. As a part of the Safe Employment Program, micro-entrepreneurs has been set up at least 12,000 families, which means 15,000 family members. More than 350,000 members of 85,000 families are provided with targeted social state assistance. About 100 low-income families, that equals 400,000 family members, were provided with food assistance by our social partners. Would also work is underway to cover about 20,000 people with unemployment insurance payment. I would also like to add that during the quarantine period, this next slide, please. Okay. The State Labor Inspection Service carried out daily control measures through the employment control notification system in order to prevent unjustified and massive layoffs by employers. As a result of control measures, about 7,350 employers have been contacted so far. The labor contracts include the employment contract notification subsystem by 22 employers raised our particular concern as unrealistic. And it was revealed that those notifications were entered to the electronic system in order to enable some individuals to leave their premises and get special permission to move freely. Relevant information collected about these employers was submitted to law enforcement agencies to investigation and further actions. At the same time, letters were sent to 156 employers who terminated their employment contract during the quarantine period to submit the relevant justifying documents to the service to investigate their termination was in accordance with labor legislation. I should also mention that currently we have 6 months data and statistics which will help us to create more developed risk algorithm to discover more lawbreakers. Apparently, serious steps have been taken to protect the jobs and wages. Purposeful measures have been taken to protect jobs and salaries in the public and private sector. The process is monitored daily via an electronic system. The state social support to formerly unemployment population has led to reduction the shadow economy and informal employment, as well as increase the number of employment contracts. From January 1st of 2020, the number of employment contracts increased to 120,000. And the number of people working in the private sector on the employment contracts was reached 760,000. As a result of the increase of the number of employment contracts, the salary fund of Republic increased at 8.24%, including more than 14% in private sector. Indeed, Azerbaijan overcomes these conditions with minimal losses, and in this context, keeping of jobs and wages into the correct economic policy produced by the state. They especially, next slide, they especially appreciate the cooperation with the Organization of Islamic Cooperation in these difficult days. We look forward to continuing our programs, both virtual and real life. Thank you for your attention. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much, Mr. Hüseyinzadeh, for sharing Azerbaijan's experience and your respected ministry's important steps to help control the spread of the novel coronavirus and social security protective approaches. Thanks so much for sharing your insightful experiences. Now, I would like to move forward to our next panelist, who will be representing Malaysia on behalf of His Excellency Engineer Omar bin Mat Piah, Director General of the Department of Occupational Safety and Health of the Ministry of Human Resources of Malaysia. Engineer Dr. Majahar bin Abd Rahman, the Director of International Policy and Research Department from the Department of Occupational Safety and Health, Malaysia. We are ready to listen to you, Excellency. The floor is yours.
Thank you, Mr. Chairman. So, Mr. DJ, distinguished panelists, thanks for organizing committee to invite me to participate in this important session. In this session, I will share about what we call it, rules and initiative by Department of Occupational Safety and Health Malaysia during movement control order. So for your information, one of the measures taken by Malaysian government to control COVID-19 pandemic is introduction of movement control order from 18th of March this year. And we have various stage of controls orders initiated by government. Next slide. So my presentation, first thing is about introduction. Secondly, current situation on COVID-19 in Malaysia. What is the current situation? Thirdly, step taken by Department of Occupational Safety and Health to continue our services during movement control order, and as well enforcement of compliance with standard operating procedure according to the sector. And we also have standard operating procedure for COVID-19 prevention at the workplace sectors, and conclusion of my presentation. Next, please. Concern is growing over the continuing rise in COVID-19 infection in some part of the world, and the ability of sustained declining rates in others. Some country the rates grow is very some sort of fast. Some country manage to so-called sustain or flatten down the curve of COVID-19 infections. So governments, employers, workers, and their organization face enormous challenge as they try to combat the COVID-19 pandemic and protect safety, health at work, and as well their employment and businesses. And there are also concerns about resuming activity in a manner that sustain progress made in surpassing transmission of the COVID-19 disease. So we must strike a balance between control of COVID-19 and economics activities, especially during movement controls orders. Next, please. The current situation on COVID-19 in Malaysia, as per 10th of August this year. So confirmed cases 9,083, recover 8,784, and it make our recovery rate 96.7%. Fatality death 125 cases on that day, and fatality rate is about 1.38%. So we have 3 phases of movement control order. First phase is, we call it movement control order. Second phase is conditional movement control order. And third phase is recovery movement control order, whereby at the recovery stage, more and more economic activity is allowed to be operated, to sustain our business and economic activities. Next. So specifically for Department of Occupational Safety and Health, so what step taken by our department during movement control order? First step is to notify our customer and clients on closing of all DOSH office and implementation of work from home system. Basically, we are close to our clients during some sort of face-to-face activity with our clients during MCO. However, we notify our client on the status of DOSH online systems such as My KKP, our online service, and SCAD is in normal operation. Luckily, we have an online system which can operate normally, and our officer have to work from home, most of our officer. So, but however, limited number of officer is working from the office during that period. Okay, we should publish the information through our social media, especially to our clients, to inform them about about our services. Next, and we also been appointed DOSH officer as authorized officer under Prevention and Control of Infectious Diseases Act 1988, and conducted joint operation with especially Department of Labor in movement control order compliance, closure of industry and business which fails to comply with the control order during the movement control order period, means through the enforcement activity at the work site. Next. And we also review construction and services sector MCO exemption application. So during the MCO, some of the activities, for example, essential services are allowed to operate at the normal rate, but certain critical activity, for example, construction activity for slope maintenance in the construction, control of traffic movement in the construction site are allowed, but they need to get prior approvals. And one of the agency that involved in the processing of this application is Department of Occupational Safety and Health. And also our officer being assigned as a duty officer at Ministry of Human Resource, or Ministry COVID-19 Operation Room, which some sort of open 7 days a week. My government control center, call center, and DOSH hotline. So basically, MOHR COVID-19 operation room, my government call center, and DOSH hotline is open throughout the week, 7 days a week. And we receive around 5,000 calls pertaining to occupational safety and health alone, but we have also entertained other issue pertaining to employment and some sort of workers' welfare issues also, because we are the Ministry of Human Resources. Next. Also, we conduct a simple survey on impact of OSH in Malaysia survey during that period. We get relatively good response, mainly from OSH practitioner, which regard what government's supposed to do, which regards which regard their renewal for their competency of certificate of competency, which regards our statutory inspection for statutory machinery, and as well issue pertaining to standard setting is the 3 main issues that highlight by the respondent of the studies. Okay, next. Next slide, please. Based on study findings, we take action, immediate action to some sort of slightly modify our system and services to meet the demand of some sort of our clients. Among others, we allow automatic 3-month extension of certificated machinery inspection, modification of competent person registration, and renewal procedure from conventional approach to the alternative approach, application of alternative method in organizing seminar, dialogues, and meetings, alternative inspection methods for pressure vessels, and recognize online training as a method to obtain continuous education program, and publishing frequently asked questions on DOSH services and COVID-19 prevention SOP. Basically, there is regularly we update our frequently asked question to some sort of arise their concern, and as well the information that our department needs to deliver to our clients. Next. So this example of published FAQ, and to make our FAQ easily understand by our clients, we use some form of infographic to explain the question and answer. So means we hope they can understand better about the questions that the FAQ by using some sort of infographic for the purpose of explaining purposes. Next. So also we organize webinar and teleconference session with the industries and OSH practitioner on COVID-19 risk management and control. So we have good some sort of participation from especially Malaysian Society of Occupational Safety and Health, Malaysian Industry Hygiene Association, private entity, and as well so-called company, especially multinational company. And as well, we involved in the published safe operating procedure on COVID-19 prevention at the workplace for DOSH services. So because government, central government published some sort of long list of SOP for specific activities, but DOSH also contribute in publishing SOP specifically for services or activity related with our services. Okay, next. And next slide. Okay, DOSH also developed and implementing MCO movement control order SOP compliance self-reporting system. So basically, this one employer had to report to our department through online platform with regard measures they take in the workplace to contain some sort of COVID-19 issues in their or to manage COVID-19 related issue in their workplace. So based on some sort of this report, initially they have to report to us daily basis, but after some sort of later stage in the so-called weekly basis. So far, we receive more than 1.5 million report based on this system. Okay, next. So based on report, I mean, given by so-called person in charge from each organization, we will verify the report, so-called given to us, either through what we call it alternative method, by phone call or by some sort of WhatsApp communication, or our officer, state officers personally visit the workplace to ensure the compliance with the SOP for COVID-19 prevention at the workplace. Okay, next. And also we, based on enforcement, field enforcement activity and alternative method enforcement activity, we publish a report daily and give to our some sort of high level officer in our department, ministry, and as well at the central agency level. Next, and also this one we produce SOP for COVID-19 prevention at the workplace. This one basically general guidelines to be implemented at the workplace to some sort of manage issue pertaining to COVID-19. For example, procedure before, current, after an emergency situation, and as well specify duties of employer, coordinator, supervisor, workers, the requirement of personal protection equipment and training, and as well control measures, and some sort of, we also give simple forms to be used, some sort of to, for example, to record the entry to the workplace, and as well for the reporting purposes. So next. So in conclusion, to date, COVID-19 situation in the Malaysia is under control. Secondly, DOSH, Department of Occupational Safety and Health, have taken various steps to ensure business function run smoothly. Our business functions run smoothly, despite the limitation of movement control order, conditional movement control order, and recovery movement control order. And number three, our department safe working procedure for prevention of COVID-19 at the workplace is a guidance documents to employers and OSH coordinator to plan and implement program pertaining to COVID-19 prevention at their workplace. Next. And number 4, daily online report during CMCO, and is weekly report on 10 June onwards, is one of a check and balance monitoring methods to a self-management program for prevention of COVID-19 at the workplace. So we want the employer especially to adhere to the concept of self-regulation in managing OSH issue in the country, including issue pertaining to COVID-19 infection at the workplace. And number 5, OSH practitioners play an important role in assisting themselves, workers, employers, and the country in our continuous effort in limiting the spreading of COVID-19 in the country, because they normally become a resource person for the workplace to report back to the department measures taken by the workplace to manage the COVID-19 issue in the workplace. And number 6, DOSH is willing to share our experience to other OIC members countries on the prevention of COVID-19 at the workplace, especially in development of guidelines and enforcement approach during movement control order. With that, I end up my presentation, and thank you very much.
Thank you very much, His Excellency Engineer Dr. Abd Rahman, for the comprehensive presentations, and congratulations to Malaysia for implementing these successful policies during these difficult times. And again, congratulations in managing to establish a good monitoring system, as you explained, in order to prevent the transmission of COVID-19 at workplaces, which are very much important. So now let us listen to our valuable panelists from Kingdom of Morocco, His Excellency Dr. Ahmed Sabri, Head of Workers' Health Service, Directorate of Epidemiology and Disease Control of the Ministry of Health of Morocco. His Excellency Dr. Sabri, floor is yours.
Thank you, Chairman. Bismillah ar-Rahman ar-Rahim. His Excellency Director General of SAISRIC, His Excellency Director General of Directorate General of Turkey, for OIC, for POSH, and dear panelists and dear participants on this webinar. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Let me introduce myself. I am Dr. Ahmed Sabri. I am specialized medical doctor specialized on occupational health medicine, and I am head of the Workers' Health Services of Ministry of Health. It's a pleasure for me to participate to this webinar, and thank you to organizers SAISRIC and OIC OSHNet and Director General of OSH Turkey for their invitation and for giving me this opportunity to present the experience of Morocco on this subject. First, I'd like to clarify that the Ministry of Health is consulting on occupational policy and strategies related to the health of active population, take part in drafting laws and regulating regulation relating to preventing professional risks and the protection plan of some risks, and have a program for health. And as you know, this pandemic is in charge to manage and take actions and strategy to fighting this pandemic. The Ministry of the Ministry of Labor is the authority in charge of the occupational safety and health legislation and control in Morocco, and so some other ministries are involved in this field. Next, please. let me give you a status of COVID today, the updated situation. Now, today, we are 35,195 cases, and the deaths is about 533. The number of recovered person are 25,385, sorry. And as you know, it seems, next please, it seems we are now in the revolution is it seems to give an image of second wave, and coincides with an increase in cases observed all of the world. And if you see, we have in this situation about 1,000 cases every day, but all of them are, well, 99% are asymptomatic without any symptoms, without clinical symptoms. Next, please. So for occupational safety and health, since January, when the pandemic beginning, the Occupational Safety Health Department is consulted by National Center for Public Emergency Operations during COVID-19 pandemic. This center is the structure is which is in charge to elaborate, establish the Moroccan politics or strategies to fight against pandemic, against COVID, and a series of measures intended for the protection of health professionals have been taken in this way. Some procedures to be followed in the workplaces in order to prevent the spread of the virus and thus protect workers from COVID-19. Please, next, please. First, I'd like to speak, to talk about workers' health, activity for health workers under COVID-19. Next, please. Next, the Ministry of Health to inform first, this is the first action that is, the Ministry of Health had to inform all health workers about pandemic evolution, for its evolution, the risks related to exposure to the virus, the necessary protection. Many sessions was organized in this way at regional level and provincial level, local level, if you want. And it's especially in the what we say the COVID circuits, because in our system we have established two circuits to go to do the medical, the hospitalization, the care, all of cares in two circuits. There is circuits for COVID and there is circuits for no COVID. And in this we have to do some many sessions of training courses and sensibilization, acquisition and distribution of personal protective equipment to all health workers, especially for those assigned in these circuits of COVID, and several communication support had been developed to ensure this action. Please, next one. There is an example of the measures relating to COVID risks prevention in the administrative structures of the Ministry of Health. Next one. Next, please. And this circular, this note, is about the health and safety measures, general hygienic rules, procedures for keeping workplaces safe, ventilation of offices and workspaces, rules about meetings, and there is also some measures about the work organization, like as turnover of health workers, because you know it's so difficult to take them in work in the work all of time. There is also some measures about teleworking. We are proceeding to teleworking for many activities, and so video conferences like as this webinar is very important. And next, please. Also, there is measures to monitor and protect workers' health against the risk exposure of COVID. And next, please. In this note, in this circular, there is many procedures about COVID-19 risk information and training, and specific protection measures as respect of medical clothes and wearing personal protective equipment, rules of incapacity for work into the COVID circuits, bad English, protocol of medical surveillance for health workers who are caring patients with COVID-19, and we have checklists for surveillance. So for surveillance of about this risk for the health workers who are caring patients in the COVID-19 circuit. Also, there is an information system and alert for these activities, and it's operated by the Occupational Safety and Health Unit, and or in same province or in same region, there is another communal infections control committee to do these activities. And so, as I say, there is a checklist about this monitoring. Next, please. In the National Center for Public Health Emergency Operation, we are operated with many departments and also some centers to collaborate and coordinate our activities. And so this center attached to epidemiology and control diseases is concerned about this actions, and there is a center team and many staff in the other structures to manage the control of epidemic in the workplaces. So, and other activities which are what is doing is the short some clip of psychological support to health workers, and there is also another the others, as I say, other departments within Ministry of Health which are participating to manage with us the activities in concerning the occupational safety and health, as hospitals directorate and communication department, and regional directorates for the control about controls control of health of the health workers. Next, please. So as I said, there is many tools which are developed for this personnel. In this slide, you see examples. So it's, for examples about the tools which are developed for example, for personal protective equipment use, mental support, hygienic measures, etc. There is many clip and video, and also some roll-up and the posters developed in this way. Next one, please. Look, for other, I do not talk about the other departments, ministerial department, which are doing many activities about this pandemic, but under the control of the Ministry of Health and the directive of Ministry of Health. But I will next piece. I will talk about some activities concerning the prevention in the workplaces, as development of preventive measures against COVID-19 in this in the workplace. There is a document distributed by ministerial letter to the Ministry of Labor and partners or stakeholders. And from this tools or this document, there is many directives elaborated by these ministries and partners to their people, to their population, the target population. Next, please. In this way also, we have participated overseeing in the implementation of this preventive measures in industrial units. There is many teams from Ministry of Health, but also with the participated teams from Ministry of Labor, Ministry of Industry and Trade, and also the Ministry of Interior are doing many controls to the industrial units if they take all of safe measures and protocols for their workers. And this from this activity, we are developing mini checklists and the model checklist, if you want, identifying missions, technical advice to industry, etc. And this an example of this activities we are doing. Okay, next, please. Same thing. We are participating to organizing the celebration of World Day for Safety and Health at work this year. You know, it's about this pandemic, this COVID pandemic, and we also participate into sensibilization and communicated to the risk for all of workers in Morocco. Next, please. Same like in the media, and now this is an example also for the participation on the communication and awareness activities on the risk associated with the COVID and protective measures at work in the official media, but also in the social networks. But this, as I say, is just an example. Next, please. Maybe in this pandemic we have many lessons, we learned many lessons about this about occupational health, and in this way there is the need and the importance, the need, see the place for the place of the Ministry of Health to provide occupational health interventions in emergency. There is a lack in this because the COVID show us that there is a big problem about emergency situations and the mechanism to deal and facing this COVID. There is also the need to establish a structure for health professional. We need to have regulations about this matter, and the importance of integrating occupational health into the primary health care to reach all working population, because if you know there is many sectors which are not covered by the occupational health, and I mean especially informal sector. And in this way, I think this COVID show us the importance of the occupational safety and health for this population, because it's very important to do something. It's a personal thing. I think is the integrated occupational health into primary health care is the best way to reach them. And it is also, there is a need, this is important for us, the need for more coordination and collaboration with all stakeholders in occupational health, because I think COVID is the new pandemic is the first time we have dealing with such situation, and it's very important to have a mechanism and system to coordinate and collaborate in order to face this pandemic and other situations emergent. Maybe I think it's the last one. Next, that's all. Donc, I think I thank you for your attention, and I remain at your disposal to your questions if there is. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Walaikum salam. Thank you very much, His Excellency Dr. Sabri, for sharing these important insights and key steps undertaken by your esteemed directorate in Morocco as response to COVID-19 pandemic at workplaces. Very informative indeed. Now we will listen to Turkey's experience from Mr. Burhanettin Kurt, Deputy Director General of the Directorate General of Occupational Safety and Health of Turkey. If Mr. Kurt is ready, I would like to pass the floor to himself. Are you ready, Mr. Kurt?
I opened my voice. Yes, I am ready.
Floor is yours. Thank you so much.
Thanks a lot, Mr. Çağlar, and distinguished General Director of the SESRIC and distinguished General Director of Islamic countries, distinguished panelists and their participants. I would like to say welcome to all of you and Assalamu alaikum wa rahmatullah wa barakatuhu. And I hope this meeting is going to be so fruitful and helpful to each of us to have more experiences for being achieved against coronavirus battle. And as everyone knows, first of all countries focused on health effects of the coronavirus to supply proper health services to their citizens. Also, countries take action to keep their health system strong to serve properly. But later on, all we realized that economical and financial effects of the coronavirus would be more devastating than health effects. To prevent devastating consequences, economic and financial effects of the coronavirus, working lives needs to be continued without any interruption. To keep working lives sustainable with safety and health conditions, firstly, we defined the methodology which should be followed. Next, please. To preparing the information, we followed the methodology in 3 steps. First steps, we establish an advisory board collaboration for getting scientific approach. That advisory board, which consists 14 academics from the disciplines of the public health, chest diseases, internal medicine, and infection diseases. Secondly, in order to increase its applicability in this field, studies have been shared with the employee and employer confederation and other stakeholders. Third steps of that methodology, we define technical information about occupational health and safety was shared by the taking into consideration the demands received from public institution and the organization. Beginning of the pandemic, we first prepared a poster which contains 14 general rules for implementing in all workplaces, then shared it with all stakeholders with the official letter. Next, please. After that poster, we considering and high risk profiles sectors. As you know, the pandemic purchasing behaviors of the people are changed because now people want to buy their needs from online platform, and the means that means cargo transportation is going to be so busy more than before. And also daily purchasing activities of people are highly increased. Because of this reason, secondly, we prepared guidelines, checklists, leaflets, posters in cargo transportation sectors, pharmacy sectors, supermarket, and bakery production sectors. We prepared all the guidelines, checklists, posters, and videos. Next, please. And as you see on the screen, later on, we totally for 19 sectors, we prepared all the documents and shared it with all stakeholders. Next, please. And you can see the pattern of the posters, and after then to make workers learn about these rules and to behave in safety in workplaces, we prepared animal video links. Is that possible to link on it supermarket video link? Can you open supermarket? Yeah. Mr. Mia, is it possible to see supermarkets?
Mr. Kurt, our colleagues are trying to reflect it, but it seems right now a little bit hard. So if it is not, if they can manage, we will inform you. And if you could please continue, we appreciate it.
Okay, next please then. Okay. It's not working.
Temasının önlenmesine yönelik düzenleme yapın. İşe uygun kişisel koruyucu donanımı risk değerlendirmenize göre belirleyin. Gıdayla doğrudan veya dolaylı teması olan tüm çalışanların EN 14863 standardına uygun tıbbi maske kullanmalarını, ortak kullanmamalarını, kirlenmesi, nemlenmesi veya yırtılması halinde yenisiyle değiştirilmesini sağlayın. Maskenin uygun şekilde takılmasını, çıkarılmasını ve dış ortamdan izole bir atık kutusuna atılmasını sağlayın. İş yerini sık sık doğal yollarla havalandırın. Sık ve veya ortak kullanılan alanları düzenli aralıklarla temizleyin. Tezgah, ekipmanlar, yazar kasa, post cihazı, raf, kapı kolları gibi tüm yüzeyleri sık sık dezenfekte edin. Çalışma alanında asgari sayıda çalışan bulundurun. Birden fazla çalışanın olduğu ortam ve veya tezgahlarda sosyal mesafe kuralına uyulmasını sağlayın. İş yerinin büyüklüğüne uygun sayıda müşteriyi sosyal mesafe gözeterek içeri alın. Ödemelerin temassız sistemlerle yapılmasına özen gösterin. Unlu mamullerin uygun ambalajla satışını sağlayın. Ambalajsız ürünlerin servisinde tek kullanımlık eldiven ya da servis pensesi kullanın. Üretim, servis, temizlik ve kasa çalışanlarının farklı kişiler olmasına özen gösterin. Covid-19 semptomları bulunan çalışan varsa maske takarak iş yeri sağlık personeline bilgi verin. İlgili personelin bulunmadığı durumlarda diğer çalışanlardan izole ederek Alo 184'ü arayın ve yönlendirmelere göre hareket edin.
Can I get my presentation on the screen again? Yeah. Next, please. Yeah, that's the right one. And the video link is a Turkish, but I want to show you that's the animal video, and it was so helpful to make worker safety behaviors in workplaces. And now I would like to mention about the occupational safety and health services in pandemic process. In Turkey, every company or workplaces need to get occupational safety and health services from DOSH professionals. In this process, DOSH professionals are mobilized to work in the workplaces. And that means occupational safety and health activities are not interrupted. What we have done for the keep going occupational safety activities in working places, first of all, temporary changes has been made into the inspection process in the application for the internal DOSH services and DOSH professional training institution authorization certificate. And basic training program is educational institution which are authorized to provide training of occupational safety professionals have been stopped, and distance education has been ensured during the epidemic. In order to increase the applicability in the field, studies have been shared with all our social stakeholders, especially Employer Confederation, Employee Confederation, Civil Servant Confederation, and Chambers of the Craftsmen. Our cooperation with our social stakeholders on this subject has been strengthened by organizations' meetings. Next, please. To prevent spread of the coronavirus, curfew declared by the Interior Ministry at weekends in Turkey starting in the beginning of the pandemic, and within the scope of the circular issued by the Minister of Interior, it was ensured that the occupational health and safety service provided into the workplaces were exempted, and that ongoing interstate travel and curfew wouldn't impose occupational safety and health services and the professionals as well. Next, please. In this term, also importance of the personal protective equipments were revealed. Before first case occurred in Turkey, Health Ministry released out a regulation to ban companies to export personal protective equipments, especially masks, clothes, and gloves. And Health Ministry started purchasing process for all these personal protective equipments from producers to supply them to health workers. As General Directorate, we are responsible to supply safety and proper personal protective equipments in the market. To supply safety products in market, we have meetings with all sides and stakeholders, and in these meetings, we spoke about to establish a personal protective equipment test laboratory on the production of masks and coveralls and mask production issues with the companies which can have a chance to produce this kind of personal protective equipments, and also technical producer related to these products, supply and distribution process of these products without any charge to all public places, all the people in the Turkey. Next, please. Next, please. And as a duty of our General Directorate, a wide range of masks of different categories and models received during market surveillance and additionally sent from international health services were tested by universal notified body and under the supervision of our Director of Staff. And as you know, importance of the product, personal protective equipment, so many companies started producing this kind of products. And that means unsafety products can be exist in the market. To prevent this kind of results, we took all this kind of products to test, and safety products are given permission to serve in the market. Others one taken from market and not giving them the permission to sell this kind of products in the market. And next, please. And we have another action in this pandemic process. We analyzed COVID-19 activities for 32 countries. We analyzed occupational health and safety activities. The course in that criteria are course of the epidemic, methods of the combating the outbreak, and economic development. After then, we analyzed results of the analysis show us that all the countries prepared guidelines for critical sectors, comprehensive, frequently asked questions and answer for employers, occupational safety and professionals, and other employee and other stakeholders. Dissemination and information activities through social media, establishment of the COVID-19 information platform to ensure that the work done is delivered to the relevant people via a single platform. In addition, we are, as a co-chair of the G20 countries Occupational Safety and Health Experts Network, emphasized the importance on sharing best practices throughout G20 Occupational Safety and Health Experts Networks on the mitigating measures taken during COVID-19 pandemic to improve occupational safety and health and to protect workers. And after, next please. After all this kind of documents we prepared, we established an online platform, a special website to give all the documents, information to all the parts of the working life. In our online platform, so many links we shared, and there was several sections. On several sections, we see the news, the frequently asked questions, links, information sources. Also, we shared in this website the other ministries' informations. We gave all the parts of the working lives. People can enter this website to get more information about the other ministries as well. Next, please. In addition to the above, documents on measures to be taken in public institutions and organizations have been prepared. Guides for working environment, measurement staff, and also for occupational safety and health professions are prepared. And document titled Physical risks in the COVID-19 process was prepared with the contribution of experts from the field in order to eliminate the social risk of the pandemic within the framework of return to work. And with the cooperation with the IL office, Turkey, Arabic translation of these guidelines was carried out and would be shared with interest parties if desired. ILO translated our documents to Arabic from Turkish and shared it from website of the ILO. And as you know, in Turkey, nearly 4 million Syrian refugees has been living after 2011, and so many of them has a right to work in the workplaces and to help them for working safety and healthy. This kind of Arabic documents is going to be so helpful. Next, please. The last slide was on it. Thank you for attention, and I hope it's going to be so helpful to all of us.
Thank you very much, His Excellency Mr. Kurch, for your informative presentation. It was really helpful. And thank you very much for your kind offer, your esteemed institution's kind offer in sharing the guidelines with other member countries of the OIC. They are available in English and Arabic, we learned. And thank you very much for your offer. I am sure that this would be a great benefit for the OIC member countries. Last but not least, we will listen from our valuable panelists, His Excellency Mr. Martin Wandera, Director of Labor, Employment and Occupational Safety and Health of the Ministry of Gender, Labor and Social Development in Uganda. The floor is yours, Excellency. Mr. Wandera, if you are ready, I would like to pass the floor to you.
Thank you very much.
Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. His Excellency Nabil Dabur, Director General CESRIC, His Excellency Kafer Uzunkaya, DG OSH of the Republic of Turkey, distinguished panelists, ladies and gentlemen. COVID-19 is a global pandemic which calls for approaches based on shared knowledge. I therefore would like to thank CESRIC and the government of Turkey for providing a knowledge-sharing platform on the impact of OSH dimensions of COVID. Uganda, like all countries, has been affected by COVID-19. The impacts have been far-reaching across different spheres. Today, I will focus on the impact of COVID-19 on the promotion of occupational safety and health systems in Uganda. Next. Next. In terms of the situation analysis, Uganda has so far 1,313 reported cases out of 3,100 tests so far taken. The number of deaths are 9. Recoveries are 1,138 and 166 active cases. A number of containment measures were taken as from 18th of March, which included closure of all education institutions, suspension of public and private transport, including air, but as we speak, only air transport is suspended, suspension of non-essential services, most of them have been lifted, except entertainment, and then the promotion of respiratory and hand hygiene and social distancing in public places. Next. The impact of COVID-19 has been varied, as I said, on OSH. Now, the first observation that we make is that COVID-19 has rendered past risk assessment and attendant control measures irrelevant because no one anticipated this. COVID-19 prevention measures have also increased the cost of doing business, including hand washing facilities, sanitizing of workplaces, and reorganizing workplaces. We also note that work reorganization and rising costs have led to telecommuting and layoffs. However, the layoffs have led to long working hours, which has been associated with occupational risks like work stress. We also note that because homes were not prepared as workplaces, the poor ergonomics at home is increasing risks for musculoskeletal disorders. We already received these complaints. Then the OSH inspection and staff have been overstretched because many of these activities were not planned for before the pandemic. Next. What responses have the government and particularly the Department of OSH taken? We developed workplace standard operating procedures for the prevention and control of COVID-19 at workplaces. These included the creation of awareness, hand and respiratory hygiene, sanitization of workplaces, work reorganization, and OSH workplace governance. The other measure that we took was to develop and disseminate workplace targeted COVID-19 risk communication. We have also stepped up and encouraged the use of adequate and sufficient PPEs, especially for frontline workers like health workers. We have also undertaken preventive training and monitoring of frontline workers. The Department of OSH has also carried out COVID-19 focused workplace inspections and has also undertaken preventive training and monitoring of frontline workers. Next. In the course of responding to COVID, a number of challenges were faced by OSH administration. One, realignment of resources of the budgets within the budget cycle, because at the time COVID set in, the budget had already been approved and there were therefore challenges to realign. However, I want to thank the government for making resources available. Then promotion of OSH for workers in telework is a challenge because OSH inspectors do not have direct access to homes unless they have been registered as workplaces. So this is a challenge that we are dealing with. The lack of conclusive and sometimes contradicting evidence on the nature and transmission of COVID and its prevention within the scientific community is also a challenge, because in some instances, some literature will say masks must be worn all the time. In certain instances, you hear information that masks should only be worn in just certain circumstances, just as an example. There has been a rising OSH-related business costs amidst no or declining enterprise revenue. For example, in the lockdown, some businesses were closed, but also because of closure of other businesses, their revenue declined. Yet at the same time, they have to increase costs of containing COVID. We also note that because people are working from home, there is rising domestic gender-based domestic tension. Because when people stay for long together, we see a rise in gender-related tension. We have also observed limited knowledge on the prevention measures by both employers and workers, because you note that COVID-19 is a novel disease which many, even us practitioners, are still learning about. Next. In view of the above challenges, there are a number of proposed policy and legislative actions. One is reviewing of risk assessment protocols to take into account COVID-19, because our risk assessment protocols had not taken into COVID-19, so we have to revise them. We are reviewing our medical surveillance guidelines, as well as the OSH inspection checklists. We are reviewing the Occupational Safety and Health Act in order to implement reforms and also make the said law relevant for future crises related or similar to COVID-19. We are also reviewing the laws to recognize COVID-19 as an occupational disease, because under the Workers' Compensation Act, only diseases that are recognized as occupational diseases are subject to compensation, even where they have been, only if they have been acquired at work. The other thing that we are doing is the development of guidelines for promotion of occupational safety and health for teleworkers. We would also like to propose that CESRIC coordinates COVID-19 OSH policy research. Because as I said at the beginning, addressing this challenge requires shared knowledge. And knowledge can only come from research, and therefore we request that CESRIC should coordinate the members in carrying out OSH policy research. Next. Ladies and gentlemen, before I conclude, I would like to observe that despite the many challenges that COVID has presented, the current crisis is a unique opportunity to reassess the central role of occupational safety and health and its eventual recognition as a fundamental right and principle at work in accordance with the recommendation of the World Commission on the Future of Work. Behind every dark cloud, there is a silver lining. And from the lessons that we have picked, there is much that we can do to promote occupational safety and health. With that, I would like to thank you.
Thank you very much, His Excellency Mr. Vandera, for your comprehensive presentation. It was great pleasure for all of us to hear Uganda's experiences and best practices and the role of OSH authority in fight against COVID-19. It was very interesting indeed to hear many success stories and good practices implemented by the national OSH authorities of the OIC countries, shaped by our valuable panelists representing different regions of the Organization of Islamic Cooperation. Thank you all once again, and let us now move to the Q&A session and try to address few questions that we have received through different platforms of CESRIC since the beginning of this live broadcast. For that, I am pleased to give the floor to my colleague who has been following the flow of the questions and analyzing them, and I believe that she is now ready and direct these questions, selective questions, to our distinguished panelists. Now I would like to give floor to my colleague, Ms. Inan, to moderate this Q&A session. Floor is yours, Ms. Inan.
Assalamu alaikum, Mr. Chalar, distinguished panelists and dear viewers. Thank you for your valuable presentations that you shared with us. Very inspiring indeed. We have received quite a few questions throughout the webinar, and I'll try my best to address as many as possible within our time limit. The first question we have received to Azerbaijan for Mr. Husseinzadeh: how has COVID-19 and the restrictive measures affected mental health of the employees in Azerbaijan? I would appreciate it if you could brief us on this situation. If you're ready, the floor is yours, Mr. Husseinzadeh.
I'm sorry, I just moved a new office, and somewhere under us is some work, as you can hear, someone is just dumping. That's
it's okay.
Clear.
Your voice is clear. Shall I repeat my question?
Thank you, if they will stop. Sorry for that problems, just problem with new office. Can you repeat, please?
Yes, so how has COVID-19 and the restrictive measures affected mental health of the employees in Azerbaijan?
Mental problem. Do you hear?
Yes, mental health of employees.
For the people with psychology affected by novel coronavirus, it must be understood that there is many groups here. Many groups of people who has some damages about this virus. But there's three main owns can be designated. Here's the people who is now recovered from coronavirus. That's the first big group. The second is a much more bigger group, which was closed on self-isolation, on quarantine. And the third group is, as I see, is the doctors. Doctors and other government workers, state officials who was working on these days. The people who has survived, who has with this coronavirus, their problem is they think about future problem with their health, because the consequences with this virus has not been studied yet as well. The second group, the people were sitting at self-isolation at home for a long time. It was hard both physically and mentally, especially people over 65 with chronic disease. They think about the consequences that may come or are fighting with those which have already come. And third big group was the doctors and other people who was fighting with this novel coronavirus. Doctors who sufficiently fight with this disease at times that cost their life this fighting. And we know that they have a burnout syndrome. And like we see all these problems just the main thing is see these problems. That's the first step to fix and manage these problems to some government officials, health workers, and other representatives of population. We must be like one big family in this problem. That's all, as I think. Sorry for the...
Thank you very much, Mr. Husseinzadeh. I really appreciate your comprehensive answer. Very important steps indeed. Now I'd like to direct the second question that we've received to Malaysia, to Dr. Majahar. So the numbers in Malaysia shows that the pandemic situation is pretty much under control, and prevention measures taken at the workplaces had a positive impact on this success. What advice would DOSH Malaysia give to other OIC member countries that are struggling to maintain responsive OSH systems? Dr. Majahar?
Thank you, Ms. Inan. So our advice to other OIC members. So Malaysia, if I can share some sort of our early so-called success story in managing COVID-19 pandemic in the country, I think it's beyond the occupational safety and health management system. Is because it's involved other agencies and the higher authority in managing COVID-19 situation in the country. Among others is commitment and leadership of our political master and head of department. For example, our Prime Minister, Senior Minister, okay, they will come up with regular some sort of statements, media statement, press release, and the ability of government department and agencies to work together and perform their duties according to so-called their specific tasks. And because COVID-19 prevention is much more crucial than so-called curative. And as well, another aspect is good communication between some sort of the government and the public. And another aspect for OSH organization, such as DOSH, we introduce so-called simple, safe operating procedure that make easy for industry especially to comply with that SOP. In fact, at our country levels, our national levels, our National Security Council already issues 35 so far SOP to be followed by industries for social activities, educational activities, and as well for religious activities. So SOP, for example, for religious activity, Friday's prayer, for celebration, so on and so forth, is available. SOP, availability of SOP. And as well, the monitoring and enforcement system is also important because to ensure compliance to the whatever SOP issued by the government, so the government agency have to monitor the implementation at the ground in terms of the implementation of the SOP, especially in the workplace. And OSH practitioner role also come into picture in this respect, because Malaysia, we have more than 60,000 OSH practitioners, whereby they can be a licensed person or coordinator for the organization to ensure minimum compliance to the SOP requirements in their particular workplace, because it's required some sort of interagency collaboration and as well acceptance from the business community and as well general public and employee to ensure success of COVID-19 prevention program. And as well, last not least, the strict enforcement. But in our country, we have slogan for COVID-19, special slogan that easily understand by everybody. The slogan is "Kita jaga kita." In English, we take care ourselves. So the message is to everybody take care themselves to contain the spread of COVID-19 in the workplace and as well as in the country. Thank you.
Thank you very much, Dr. Majahar. Really important steps followed by OSH Malaysia, and I hope these would inspire other OIC member countries. Now I would like to move to the next question that is directed to Morocco. So how monitoring activities were differentiated while overseeing the implementation of preventive measures taken against COVID-19 in different industries? And how is the effectiveness of the checklist model and technical advices conducted to different industries in the implementation of the guidelines and requirements developed to protect workers from exposure to COVID-19? Dr. Sabri, I would appreciate if you can briefly answer this question.
Yes. Thank you, Samiha. Very important question. I think, well, as you know, the professional activities have been reduced minimum to minimum. Only the activities of what I say, the food and goods chain, as well as those of the textile, are maintained, and some strategic factories are maintained. And in this way, for this, the priority is given by the prevention actors in the workplaces to implement, if you want, the protective and measures against COVID. You know, after the end of the state of health emergency in Morocco, the transmission will be, it became more communal and through the general population, and this explain, if you want, the appearance of some or several clusters in the industrial area, and also about this, you know, we are notified that there is a lack for adhesion to the adherence to the rules, if you want, and but I think for this we are looking for more coordination with all of stakeholders in this way, and maybe is a big deal, because also in our context, in our country, Morocco, we have big deal to face with information system. We need to have a good information system to have more information about all of risks in the workplaces, and also to have more practice to face pandemics or other risks in workplaces.
Thank you very much, Dr. Sabri, for your answer. I do believe that more cooperation and collaboration among the members of the OIC OSHNet network would definitely benefit OSH institutions. Now I would like to direct another question to Turkey. How do you monitor the implementation and commitment to the prepared guidelines in workplaces? And how did you avoid the interruption of OSH services during enforcement of COVID-19 lockdown in the country? Mr. Kurt, if you're ready.
Yes, I am ready. Thank you for your questions. As you asked, everyone knows the inspection in Turkey, inspection activities are under inspection board institutions' responsibility. And inspection board institution is responsibility are making activities under our ministry as well. But in this term, in pandemic term, to inspect to companies is another risk of spread of the COVID-19. That's why inspections activities in these terms by inspectors are stopped. But as I mentioned in my presentation, all workplaces are need to get occupational safety and health services from professionals. And in workplaces, if there is any fatal risks or any not being implemented rules of the occupational safety and health, professionals have a chance to apply to the inspection board to inspect their companies. That is the role of the this kind of inspections activities in Turkey. But the main things needs to be, safety cultures needs to be established in all all the places, all the society. Otherwise, as you know, in Turkey, nearly 1,800,000 workplaces exist. To inspect all of them is not possible. That means all workers and or employers needs to get the safety culture, and they need to use all the rules of the occupational safety and health in their workplaces to prevent occupational accidents and this kind of infected the coronavirus. And the second question, as I mentioned, after Interior Ministry was declared the curfew in the Turkey, especially starting beginning of the pandemic at weekends, we contacted with the Interior Ministry's staffs to get permission for our occupational safety and health professional to mobilize the working places, because in these terms, as everyone knows, occupational safety and health importance are more than any time needs to be used, needs to be implemented in the workplaces. To contact with the ministry, Interior Ministry, we get a permission and use this kind of regulations and also this kind of rules in the workplaces by occupational safety and health experts.
Thank you very much, Mr. Kurt, for the clarification. I really appreciate that. And now I would like to direct the last question due to our time limitation to Mr. Wandera, to Uganda. Which communication tools were used to provide adequate information to employers and employees about the measures needed to be implemented at the workplaces to prevent the spread of the coronavirus? And what were the response of the private and public sectors to new standards and norms at workplaces in Uganda? Mr. Wandera, unmute your microphone, please. Thank you.
Thank you very much, Semiha. An interministerial COVID-19 Risk Communication Committee was established. This committee came up with a risk communication strategy and interventions, which used a number of measures to communicate. This included the use of social media, including webinars like this, TV and radio, as well as the print media. But then also OSH inspectors who visited workplaces had meeting with employers and workers to communicate information about the risk and the measures for prevention and control as articulated in the workplace COVID prevention and control guidelines that I spoke about. Thank you very much.
Thank you very much, Mr. Wandera, for the comprehensive answer. With that, we come to the end of our Q&A session and almost to the end of the webinar today. Please allow me to pass the word to the moderator, Mr. Onur Çağlar, the Acting Director of Training and Technical Cooperation Department at CESRIC, for the wrap-up of the webinar. Mr. Çağlar, the floor is yours.
Thank you very much, Ms. Inan, for the excellent moderation of the Q&A session and passing me the floor. And thank you very much to our panelists for their very explanatory answers to the questions we received. I would like to sum up the presentations delivered by our valued panelists throughout the webinar today. And if you allow me, I would like to underline the important points which were mentioned. We have listened from success stories from our panelists and the OSH authorities, how they manage to set online platforms to facilitate information access and provided, for example, frequently asked questions and established hotlines to respond to the received questions and inquiries. Also, some OSH authorities started awareness campaigns where they developed posters, TV advertisements, PPT presentations, or leaflets to be distributed in workplaces to highlight the risks associated with COVID-19 and the necessary preventive measures according to each sector and its nature. In addition, we realized the focus on ensuring effective personal protective equipments that is compatible with the international standards and their availability and sustainable access, especially among the frontline workers, which stands as the most important preventive step in all countries. Another key step that was undertaken by many OSH authorities was publishing guidelines at national level that covered many policies such as general hygiene rules, ventilation of workplaces, teleworking methods, risk information, and such, which consequently require a close follow-up and monitoring systems to ensure that all employees are following these guidelines and applying them on daily basis. Many lessons learned from today, and our valuable panelists have shared very important points, such as the importance of integrating occupational safety and health into primary healthcare systems and the urgent need for collaboration among the relevant institutions in the OIC member countries. We are hopeful that these collaborations will help us to confront these challenges together towards a brighter future for our member countries during these difficult days. With this, we come to the end of our webinar today. With this opportunity, I would like to kindly remind the relevant stakeholders and national OSH institutions in our member countries about our upcoming 4th meeting of the OIC OSHNet, which is going to be held virtually this year on 7-8 October 2020 due to the given circumstances. We will discuss and adopt new rules of procedures and 2-year work plan 2021-2022 of the OIC OSHNet in this virtual meeting. I would like to thank to the members of my team who worked today behind all these things to facilitate the organization of this online event. And of course, many thanks to our distinguished panelists who accepted our invitation and made inspiring presentations today. Finally, thank you all viewers for designating your time and listening to our webinar. I wish you all the best from Ankara, Turkey. Vesselamu Aleyküm ve Rahmetullahi ve Berekatuhu.